Inspira alegría y contagia ilusión. Y el corazón se acelera y es que la gente de mi tierra sonríe llena de optimismo. Lo que nos sobra es amor, que con su voz me enamora, con sus palabras convoca a sumarnos todos juntos y mi país sea mejor, mejor.
Somos todos colombianos, no importa tu partido, si juntos sumamos. Construir futuro es lo que más queremos. Suma, suma, compañero.
Y el corazón se acelera y es que la gente de mi tierra sonríe llena de optimismo. Lo que nos sobra es amor, que con su voz me enamora, con sus palabras convoca a sumarnos todos juntos y mi país sea mejor, mejor.
Más Colombia.
Recuerden que la siguiente intervención se llevará a cabo en inglés. Las personas que aún no han solicitado sus equipos de traducción se encuentran justo al ingresar a este auditorio. Nuevamente los invitamos a seguirnos a través de Twitter como @ANDI_Colombia, a unirse a la conversación digital con el hashtag ANDI Foro Salud. Asimismo, en Instagram nos pueden encontrar como ANDI Colombia Oficial. Muy bien, ahora vamos a dar paso a la doctora Ana Van Poucke, directora global de atención médica de KPMG, con la conferencia Cómo rediseñar los servicios de salud para obtener mejores resultados. Adelante, bienvenida.
Thank you very much for introducing me so nicely. And I'm really very delighted to be presenting here in Colombia and to be invited by my colleagues from KPMG Colombia to be sharing with you some insights from around the globe and what that can mean for healthcare in Colombia. What I'm going to do with you, I'm going to focus today on what we can do in order to redesign healthcare so we can really start delivering value in healthcare. Value for the population, value for your patients. Short introduction, and I was already introduced. I lead KPMG's global healthcare practice, and that means that I lead 5,000 professionals who work in 70 countries. I have an experience of more than 30 years in healthcare, so I think I know the sector pretty well. And what I'd like to do with you today is, from my trips to several countries, bring quite a lot of experience on what are the best practices in healthcare and what are the lessons learned for Colombia that they can apply to improve their healthcare system. When I was preparing for this trip, I was, of course, reading a lot about the Colombian healthcare system, and it's so good to see that Colombia actually has a very strong healthcare system. It's in the top ranks worldwide. I read that Colombia has 22 of the 33 most important and best hospitals in Latin America. But what is also very important is that you have a health insurance system that covers about 98% of your population. And that's really important, because what we see, and I will allude to that a little bit later on, is that healthcare and having strong healthcare and having a very good health and wealth of your population is going to contribute to your wealth, and it's going to contribute to the GDP of your nation. So Colombia is doing great. Does that mean there's no room for improvement? Of course there's room for improvement. And what you need to do in order to stay good, you need to keep on investing, collaborating, and you need to keep on innovating in healthcare. Now, let me take you around the world a little bit. When we were entering the end phase of the COVID-19 crisis, we in KPMG were very curious what had COVID-19 meant for the healthcare sector worldwide. What were CEOs seeing? And what did they think? Where are they? And what was on their agenda for the coming years? And in order to get that view, we interviewed CEOs from very large healthcare systems worldwide. We spoke to 200 people to see what was on their agenda. And what I will do is I will take you through some of the findings of this survey and of this research and see what is applicable to Colombia. Now, what was a very amazing fact for us is that COVID-19 has really changed the needle on what needs to be done in healthcare. And let me reflect on that a little bit. COVID-19 was, of course, a huge crisis in healthcare. But COVID-19 wasn't only a crisis in healthcare. What COVID-19 showed us is that when the demand in healthcare is so much higher than the supply we have, it means that we're not only handicapping healthcare, but we're actually stopping the functioning of whole societies and economies. And that means that we have to keep investing in our healthcare system. Now, I'm very clear in my views that COVID-19 isn't just a one-off event. I'm part of a World Economic Forum Partnership program, and I was in Davos 2 weeks ago, and I was leading a session there. And when you speak to people from all across the globe, they all say it's not only COVID-19 that created a crisis in healthcare. Actually, there's a much bigger crisis in healthcare looming. And that's due to the fact that due to climate change, we will see migrations of population across the world. Wars, political unrest will create refugees. We see a lot of inflation. We see less means available for healthcare. And what we especially see, we see an aging population. We see more non-communicable diseases. We see more multimorbidity. And at the same time, every country is having a problem with their workforce. So what we're expecting is that actually COVID-19 is just a first sign of the times, and that we will have a situation where healthcare is overstressed and overdemanded much more often. And that's actually reflected in the results you're seeing here. Pre-pandemic, CEOs said, and had transformation on their ways, was only 62%. But after COVID, 97%, nearly all of them said, I have accelerated my transformations because I have discovered during COVID that I need to change my system in order to be sustainable. And the bottom finding, that's quite remarkable. 79% of all the CEOs, and this is worldwide, are saying that in the next 3 years, all aspects of healthcare and of care delivery will be transformed. Now, I don't know whether you can imagine that, and I always say, let's not make it 3 years, let's make it 5 years, and let's make it all aspects, but 75% of it. It means that we are going to see a huge transformation worldwide in healthcare in the coming years. And wherever I travel, and the last months I've been traveling to the US, I've been traveling to India, I've been traveling to Dubai, to Saudi Arabia, to the UK, transformation in healthcare is taking place everywhere. Now, what are the main concerns and what are we going to fundamentally revise after COVID? It's quite funny to see the results because what we saw when we looked at this, we saw that all the transformations that are going to take place are mainly going to be in the front office. So there's going to be transformation in workforce. The digital delivery is going to be the big transformation in healthcare in the coming years. We're going to change the operations. We're going to change care delivery models. There is going to be change in the back office, but that's going to be much less profound than the transformation that we will see in the front office where healthcare is being delivered. One element, and that's where I'm going to do a bit of a deep dive with you, one element that the CEO thought was going to be very important in the transformation in the coming years is the fact that there's going to be much more focus on patient centricity. And when I talk about much more focus on patient centricity, I don't mean that when you get into a hospital you get a nice cup of coffee. I mean, of course, the nice cup of coffee is very nice. But when we talk about transformation for patient centricity, it means that we start taking the patients and the needs central in what we're going to do. And let's just take a diabetes patient that I met in the UK. He told me that the doctor was all the time talking about, his blood pressure and his glucose levels and whatever that was. And he said, but that's not healthcare for me. What quality of care for me is that I want to go to my bingo morning with my friends. And he wants healthcare to be adapted in a way that he can live the life that he wants to live and not what the doctor thinks is good for him. So patient centricity is going to be very important. Every CEO has it on its radar. We are not investing in it enough. So a big change needs to take place there. Now, when we talk patient centricity, we talk, of course, the value we deliver for patients. And what can we do on different levels in order to improve the value that we deliver to societies and the value that we deliver to the population? There's 2 levels and there's 5 ways that we can be working on. First of all, there's the organizational level. Secondly, there's what we can do at the regional or at the national level. Let's have a look. Let's start with the organizational level first, and let's look at outcomes. A very classical approach to value in healthcare is to focus on the outcomes. And what we see worldwide, and this morning I was having a conversation with the CEO of Mellery. Do I pronounce it right? Mellery. And he was also talking about the fact that he wants to have some special clinics where he's focusing on certain disease groups. A very good example of this is in Germany, where we have Martini Kliniken, who is world leading in all care for prostate cancer, and who have spectacularly better results than other clinics. They're in North Germany, but people from Switzerland, from Austria, from the Netherlands, from Denmark, all come to this clinic because they're so very strong in the value that they're delivering. They're very focused on one singular thing. They're very focused on learning from whatever they're doing all the time. And by doing that in a very dedicated way, they're creating very good outcomes. Now, that's a very good way of looking at healthcare, but the reality is that healthcare is often much more complex than just a singular disease. We have patients with multimorbidities, we have patients who have social problems, so how can we deliver care in that way? Another approach, apart from the outcomes in delivering care and in increasing value, is when we start thinking about patients and we start thinking about the pathways that they're going through. Now, this is an example I took with me from Israel. Israel had huge problems in workforce. They didn't, and Hadassah Medical Center didn't have enough nurses anymore to deliver good quality of care. But they wanted to be focusing on the patient journey and how the patient not only had very good results, but how the patient also experienced the patient journey. Now, that's very difficult to do if you don't have enough nurses to do that. So what they did, they totally analyzed the care pathway, and they digitized a large part of the care pathway. So by using chatbots and natural language processing, and by using artificial intelligence, what they're doing now is patients can have 24/7 access to Q&A. So I'm a patient with breast cancer, and I need to go to my chemotherapy tomorrow morning. And suddenly in the afternoon, I start thinking, do I have to be sober? Can I eat a meal in the morning? I can now pick up the phone, and the chatbot will help me. And if the chatbot can't help me, the chatbot will refer me to the doctor or the nurse in charge, or the doctor or the nurse on call. So I'm helped 24/7. They use AI to provide much better information. So if I'm a patient who has, a lot of nausea because of my chemotherapy, I get a lot of information about chemotherapy and what can I eat and how can I prevent that. They also use big data to recommend and prescribe medication remotely via pharmacy, but also much more dedicated to my needs. And they also do things like, when I have to go to the hospital, like I need to be scheduling my visit, what they factor in here is they factor in questionnaires, do it with chatbots, and that means that when as a patient you go to the hospital, all your information is already there. And it means that the nurse or the doctor can really focus on what they need to do with you and what they need to discuss with you, and don't have to go through endless lists. So thinking about care pathways, thinking about how do patients experience care pathways, and how can we use digital to improve this because we don't have workforce, is one of the stronger ways of starting to deliver healthcare, starting to deliver value in healthcare. A very short other example, and I won't allude to that too long, is what they're doing in Geisinger in the United States, where they also analyzing their care pathways all the time, looking at all the data, and they are trying to standardize and accommodate their care pathways all the time. And by doing that, they're really increasing their performance, having less lengths of stay, having lower hospital charges, having reduced hospital mortality. So, on the organizational level, working on outcomes, but definitely designing very strong care pathways are very important means of increasing value in healthcare. Now, what can we do at the national or the regional level? I don't speak Spanish, but I was listening to some of the presentations, and I noticed that all of the presentations are about the digitization of healthcare. Now, if we want to really be using digital in healthcare, we may be looking at what's possible tomorrow, but what we actually need to start doing is looking what's possible the day after tomorrow, and what's possible in a few years' time. And I'm going to take you quickly to what we see happening in healthcare. What we see is that there's a number of trends that are taking place. Virtual reality and augmented reality are going to be very big influences in healthcare. And just imagine in augmented reality, and this is an example from Australia, and I mean this could be valid for Colombia as well. We were talking yesterday about Choco. Is it the region or the city of Choco? Very remote area and very little accessibility to healthcare. Now, if you have a good healthcare coverage, you also want to have very good accessibility to healthcare, because coverage without accessibility is not going to help you. What we see is that virtual and augmented reality are really going to be very important in improving access to healthcare. Just remember the community worker or the health worker in the remote area who has the glasses and who, for example, helps a pregnant woman. And on the glasses, he gets all the information about the woman, but on the glasses, he's also connected to a university center here in Bogota. And the gynecologist or the nurse who's sitting here in Bogota is looking with this person to this woman, to the patient, and seeing what's happening, and is guiding the social worker, is guiding the health worker to do what he needs to do. So augmented reality, virtual reality are going to be very important to help patients to work on their health, but they're also going to be very important to help healthcare workers to deliver health. Remote access is going to be one of the big trends, and we were talking about that this morning. And actually we saw during COVID that because hospitals were so full, people with COVID were being sent home, but they were being sent home with all the tooling to measure their oxygen levels and their blood saturation and things like that, and with the tooling. And by doing that, they could empty hospital beds for more severe patients. And what we're actually seeing is that remote access and remote monitoring and having the hospital at home and leading the hospital at home, servicing it from the center, is going to be a big trend. The last one is digital twinning. Digital twinning is going to be the marriage between everything we know on genetics and DNA and what we do in artificial intelligence. And in digital twinning, for example, just imagine someone who has diabetes and his or her life situation is going to change. With digital twinning, you can very well start to predict what's going to happen and start intervening much earlier. So, there's going to be a very big change in healthcare. It's going to be much more about personalization. And I think what we're going to see is that hospitals are going to be much smaller and value is going to be delivered at home or very close to home. And that means that our ecosystems and infrastructure in healthcare are going to see a total change. Israel is actually leading on this development. What Israel is doing really good is that they are now starting to have very strong integrated IT systems. And just think about the trends I was just talking about, like augmented and virtual reality. Things like that won't work if you don't have a very good digital infrastructure. And it won't work if you have electronic medical records that you can share between different providers. What Israel has been very strong in is that they have integrated IT systems where they share all the EMR data between the family doctor, between the community nurse, between the hospital, the patient, him or herself. And by doing that, they can have a much more profound treatment of patients. Because they're sharing this information, they can predict much better what is going to happen to a patient. Just imagine you're sharing your information and the GP knows that if a patient comes in because he has problems with insomnia, because the doctor already has all the information, he knows that the real problem is not insomnia, but is high blood pressure or obesitas, and can start working on that. Israel is combining that with a very strong research attitude, and that means that they are evolving and improving their healthcare delivery all the time. So what they have is they have integrated IT systems, they have research on the back of that, and because they have that, they are capable of improving the healthcare delivery and making it more personalized day by day, even bringing it so far that when I'm a patient, I log in to the site of my provider and I have a personalized web page which is going to give me information about my situation, what I need to do I need to eat different foods, do I need to exercise more? And that's when you start to have closed-loop situations. You see that in the results of the Israeli health system. Israel is spending about half of the money that most of the Western European health systems are spending on their healthcare systems. However, the results they have are better. And that's a very strong proof of the fact that it's a strong system. Now, if you think about all these changes, you need to start thinking as well, when I want to realize this, what is healthcare going to look like? What is my ecosystem in healthcare going to look like? And we have been working with a number of countries to develop what we call a sort of regional ideal infrastructure. And the regional ideal infrastructure is focused on 4 elements. It's not focused on curation, but it's focused on prevention and early detection. It is focused on first contacts through digital channels, but when digital channels are not enough, it's then focused on what we call very easily accessible, integrated generalist teams that are working in the community. And I'll say something more about it. And then the 4th point it's focusing on, it's when you need to deliver specialist care, you're not going to deliver that in a physical-only model anymore. You're going to deliver that in a blended care model. And I'll give you some example. You see the picture on the left. Central in the ecosystem of the future is the care control tower. And that care control tower is connected to a lot of the devices that patients and citizens have at home, but is also connected to a very big service center where actually you can monitor how your population is doing. So just imagine that for oncology, you will be able to give chemotherapy at home. The patient is at home, gets his chemotherapy, the community nurse comes in, locks the patient onto the chemotherapy, and by digital means and data and analytics in the service center, you can see the whole time what's happening and how the patient is doing. And that way, if you know that something is wrong, you can send someone immediately. Whereas if everything is all right, you don't have to act. A lot of systems are already working on that. Continuous monitoring in COPD, continuous monitoring in diabetes. And when you do that, you can work on exacerbations much earlier and rather work on prevention and very early intervention than on complex procedures. Next to the care control tower are what we're seeing, and we're seeing that, for example, in Israel, but we also see this in the Nordics, are community health centers. Now, community health centers are not only family doctors or GPs who are working there. A community health center is actually a combination of social functions and of healthcare functions. What we see in the US from research is that patients in cardiovascular diseases, if patients have debts, if they have housing problems, if they're unemployed, they have much more physical problems than when they don't have that. A learning from that in the US is now, in a number of systems, that they don't start working on treating the patients for their cardiovascular diseases, they start working with social work to help out in the debt problems, in the housing problems, in the unemployment problems. So the community centers are based on medical, they're based on mental health care problems, they're based on social care issues, and they work together and actually have the assignment not to treat people, but they have the assignment to keep a population healthy. So that's the second one. Apart from that, you will need a number of institutions where care is being delivered. And what we saw in our CEO survey is that hospitals and CEOs of hospitals were actually confirming that. Hospitals will be changing in the future. Hospitals will not be anymore, the very big buildings where they do everything. Actually, hospitals will be the centers for very complex and acute 24/7 healthcare. And the rest of the care will be delivered in elective centers. Think centers for hip replacement, think centers for eye care. And a lot of the care will be provided at home. And I was talking to the CEO of Medley, and he was actually saying, yes, this is what's going to happen. But it means, if we're going to work on a healthcare system like this, that we really need to start rethinking what we pay for and who we're paying. And I've been working on a lot of these transformations, and it's the way where we need to go, but it's not an easy way to go, because doctors will be afraid that they will start losing their incomes. Or hospitals are starting to think, but what are we going to do if we don't do all these treatments anymore, and we're going to be a center of, just complex care? And this means that in order to realize this, it needs to be a transformational journey where not only hospitals or doctors are responsible for making these changes, it's something that you need to do in cooperation between governments, between communities, between providers, between social care, and also private partnerships. Because if you think about the digital transformation, it's going to be very hard for healthcare to deliver that transformation, because the digital transformation is a very complicated transformation. And that's where we see that apart from this and the cooperation between providers, governments, and others, we also need to start factoring private companies to help us in making this transformation and pulling it through. Some last remarks from my side, and this is a very nice example that I have. When you start transforming healthcare, and when you start transforming the function of hospitals, there's quite often a very strong political resistance and a very strong resistance from the population. And I was referring to the example in Poucke again. What is going to be the solution for healthcare in Poucke? Is it going to build a lot of hospitals there? Or is it actually going to redesign healthcare there and start investing in digital care, start investing in community care, in community centers? What in my experience is very important when you want to realize a transformation in healthcare, it might be a very good idea to also include the population in this. And this slide is from an area in my own country where I worked, where we had two hospitals who were fighting each other, who had to collaborate, who couldn't collaborate, and where we had a problem with the hospitals because the area was just too small to have two hospitals. And we feared that there could have been a lot of resistance against merging the two. And what we did is we asked the population of that area, when you think about healthcare, what do you really want? And the funny thing is, when you ask people what they want from healthcare, and this is once again thinking about patient centricity, they don't tell you, I need a hospital on every corner of the street. What they will tell you is, I want to be a person and I don't want to be my disease. And I want you to help the people around me to take care of me. And I understand that I have to travel when I need more complex care, but can you please take care that all my information is there so I don't need to do the same test 5 times? And they also said, we don't need a hospital in every village, but can you please take care that you combine a number of functions, that you bring primary care, community care, social care, and a number of social functions like restaurants, shops, pharmacies, that you can bring that together. And I learned from this project in my life that when you want to do a transformation and when you want to create real patient centricity, it's very important to also bring the end user in and ask the end user what he or she wants to get from healthcare. Last point, and then I'm going to make some concluding remarks. Transformation is not going to take place in healthcare if we don't change the reimbursement system. Now, Colombia is doing a great thing now with the, the prospective global funding. I was quite amazed because if you compare it to what other countries are doing, what Colombia is doing in the payment systems is really very progressive. It's really thinking ahead. But for the global prospective funding to work, I think you will need to think through and experience even more to make the change. We were having a discussion with some of the startups yesterday, and they said, yes, we have the global prospective funding, but still it's very difficult for us to become a part of the care pathway. And it's very difficult for us to be paid on the right level. And if we change healthcare, it might be the case that some doctors will have less work, and doctors will find it very difficult. So I think apart from the global perspective funding, which is great, I think you'd need to be thinking as well, how can you make the payment system synchronized with the change that you want to create? And an example from the US, where we changed the healthcare system, where we realized a transformation, is that we there took a stepped approach, where we said, first of all, we're going to cap the total payments, and we're going to tell all the providers, this is the amount of money for which you have to deliver care. Then we were paying them to be working together with others. So we were paying them when hospitals were working with GPs or when they were working with startups or tech companies that could ease the stress on the healthcare system. Then we started to reward them on the outcomes and on shared savings. And finally, we could actually bring the risk totally to the providers and to the systems because they were adapted to that. Well, reimbursement is a very complicated subject. I'm not going to go into the technicalities, but I think what is very important is that you have to realize, I think, a number of things. Change needs to take place. It takes quite a lot of effort, and it takes quite a lot of thinking to do it, and it won't work if you don't work together, and it won't work if you don't adapt your reimbursement system to it. My final remarks. What do you need to do when you want to transform healthcare? First of all, I think it's realizing that transformation of healthcare at this moment is not a choice, it is a necessity. Secondly, if we want to transform healthcare in the right direction, we need to start thinking about patient centricity. For a very long time, healthcare has been determined by those who provide it. We need to change that. We need to start thinking from what patient needs and what populations needs. We need to fundamentally start rethinking our care delivery models. Start thinking about new ecosystem and who is doing what. We need to be very serious about digital health, and not only about the digital abilities and capabilities and possibilities of tomorrow, but start thinking more in another horizon and start thinking about what's possible in the future and start factoring that in. we need to start thinking really hard about how we can take the strain away from workforce in healthcare. And at the same time, we need to start thinking about what are new roles? Am I still going to hire doctors? Or maybe am I going to hire more data scientists? Am I still going to hire nurses? Or maybe also some social workers? Leadership is very important. If the leaders in healthcare are not going to be the ones that are going to be really leading, it's not going to happen. And that means that you need to be very brave. And finally, don't change healthcare if you don't think about the outcomes that you want to realize. And don't start thinking about changing healthcare when you don't want to be really committed to be really driving improved outcomes. Do it together and think about the patients. With that, I thank you and wish you a very good day.